Hello, everyone. This is Experience Matters with Eric Newton. Today we have Dr. Ted Swann with us. We're excited to have him. Ted and I have been friends for a very long time, go back to our college days. And so I've been trying to get him on the podcast for a while, and he finally decided to join me, which I'm super excited about. So, Ted, let's just jump right in because I know you got to go see patients.
Yep.
Tell everybody um, tell our audience, how you got to where you are, and like give us a little bit of a history of Dr. Ted Swann.
Yeah. So I'm a family doctor in Clemson. I've been here, I think I'm going on year 21. And Clemson's just been a blast of a place to be a physician. We had a good time in college, but I didn't think about what it would be like to raise a family here. And it's just been fantastic. So I've loved being a doctor. I'm from Greenville originally, came to Clemson, met you. I probably credit you with my fantastic college experience. But we both know we both know how fun it was and what a time of development it was for us personally. So getting an opportunity to come back and work here in Clemson has just been tremendous. And you remember my mentor, Dr. Dukes, and how we developed a relationship.
Great
here.
man, yeah.
And so he gave me a chance to come back and work with him, which was just unbelievable. So I had an awesome start and have just really enjoyed being a part of this community.
Before we talk about your boots, because I think there is a story behind the boots. Those are very cool.
Thank you.
Talking about Clemson experiences and when we were in school,
Yes.
one of my all-time favorite sporting events, period.
I know what you're going to say.
Yeah, was my sophomore year, your junior year.
Yes.
I think it was 96.
Late spring.
Spring of 96.
Yeah.
You remember?
I had just been elected student body president.
Yeah, that's right. And you invited me to go with your parents to Greensboro.
Yep. ACC basketball tournament.
Basketball tournament. And Greg Buckner had the awesome dunk to win the game against North Carolina.
Yeah, again, we stuck it to Dean Smith.
Yeah.
In an emphatic, it couldn't have been better.
It could not have been better.
And you know who was part of that was Terrell McIntyre.
Right.
Who's one of my favorite players.
Yep.
You probably don't know this, but Terrell's son, Emery, is a star basketball player, and he's the starting point guard right now at Daniel with my son Will.
Yeah.
So that's kind of a full circle. Never thought that I would have that connection with Terrell, and they're doing really well. They just locked up the region championship, 10-0 in region. 2 more games this week, so they'll have first spot in the playoffs. And
who are they playing?
Well, we don't know yet.
Oh, okay.
We don't know yet. We've got 2 more games this week, so we'll find out.
Yep. When I see Terrell, I still call him Boogie. Yeah. So yeah, he was one of the best point guards to come through Clemson. He was awesome. Fun to watch.
Yeah. T-Mac.
Yeah. There were a lot of good players on that team.
That was amazing. Yeah, that was and even Greg Buckner with Ace.
With Ace here, yeah. I love Ace.
Heck of a year. Oh my gosh, yeah.
He's so much fun to watch.
Yeah, he's super competitor.
Yeah, and he plays very similar to his dad. I mean, he maybe has a little bit better ball handling skills, but he's fun to watch.
He just kind of he finds himself. He finds a place that's open.
Mm-hmm.
He'll make a shot, and then he's not the only one. But man, he is fantastic taking the ball to the rim.
Mm-hmm.
Kind of body control.
Yeah.
Against bigger people. But finishing, it's impressive. This is a fun basketball season.
It has been fun.
Yeah.
It's been a lot of fun.
Yeah. Sure.
So let's hear the story about the boots.
Okay. Well, so I'm a family doctor, as you know, and I love what I do, and I take my job seriously. Being a physician gets into your soul, and so we've got Clemson's a really cool place to be a doctor and a lot of interesting patients. But one of our great friends and mentors, Bobby McCormick, God rest his soul. I was honored to have him as a patient. I'll tell you that as a physician, the biggest compliment you can ever have is for the people that you looked up to growing up when they end up choosing you as their doctor. I mean, there's no higher compliment. But so Bobby was really special to me, and he had kidney issues that kind of were deteriorating. And, he had spent his summers in Bozeman, Montana in the environmental think tank, PERC. And so he went out there every summer. And he went out there a couple summers ago. And I saw him before he left, and he was doing pretty good. And then I started to get these reports that he wasn't doing well. And I was trying to kind of figure that out. And our friend Bud Hicklin was telling me. And all of a sudden, he's like doing terrible. And he'd been put on hospice. And it was just, I was like, what is going on? And so I called his physicians out there. He kind of had a little bit of a medical team out there, cardiologist and nephrologist. And they would just not talk to me the way I'm used to talking to physicians. Physicians take your call. It's just like a way you work. And I couldn't get really a straight answer from them. So it was bizarre. So I flew out there. I made my longest house call ever to Bozeman, Montana. And it was, house calls are really cool because you get to almost soak up the environment, and you see a patient from in a little bit of a different light. Mm-hmm. And all I really did was for 2 or 3 days, I just kind of sat there and kind of soaked it up, but I was able to look at his medical records. And I felt like I figured out that he was simply probably being overtreated. And he felt really terrible, partly because of the medicines. Now, he was sick, but he felt worse. So anyway, he had a visit with his nephrologist, and I didn't have any fancy boots, and so we're in Bozeman, Montana. So I'm like, okay, I'm going to go to this appointment with Bobby, and then after this, we'll go downtown Bozeman. I'm going to get some fancy boots. Well, at that doctor's visit, Bobby said, "What'd you think?" And I said, "Bobby, I think we can do better at home." And so he's like, "Let's go." So the next thing you know, he called in a favor, and we're on a private jet back to Clemson from Bozeman in 2 hours. Wow, it was crazy. And he had this just this beautiful kind of resurgence of vigor and vitality. He's called himself Lazarus. He's like, I don't know what's going on. And it ended up being fairly short-lived, but it allowed him to have this 2-week reunion experience with all these important people and all these people that loved him, right, that wanted to see him. And I had to check on him. After work, I went to check on him every afternoon, and he made me drink bourbon with him. That was part of the deal. So that was fun. But anyway, he ended up passing away and almost got his wish. Mm-hmm. And so it was really a beautiful thing. Kind of went out the way he wanted to go out. But I never got those boots. And so the next summer, my family likes to go to dude ranches for vacations, and we don't do it every summer, but we had a plan. So we flew. We were going through Bozeman. So my first stop, got off the plane, drove to the store that I was gonna go to, and bought these boots. Wow! So these are my Bobby boots. Wow, it's a great story. Yeah. I didn't know that story. There you go. Yeah. So they're very meaningful. Yeah, I can see, and they're orange. They're orange. Yeah, I love it. What is that? Is that what is that? Velvet? It's gator, right? They call it caiman. Caiman. I think that's a fancy name for alligator. Alligator. Yeah. They're definitely the nicest things I own. Well, you may not know this about me, but I, a lot of my wardrobe now I buy like on Amazon. Like I just, or I'm a sucker for Instagram ads. Yeah. But one of the ways that I reward myself when I do something good is I buy boots. Okay. So I've got like this boot issue, and it started back in like 2013. Okay. And so I bought a pair of nice boots. Yes. Really nice boots. And every time I did something great, I'd buy myself a pair of boots. Yeah. So I've got a closet full of boots now, and my wife does not like it. I think I know somebody that you can talk to about this. We got a diagnosis for that. Yeah. Yeah. So, but anyway, I love boots. Yeah. And I really like those. Thank you. I'm jealous. It's all right. You can borrow them. Huh? I can borrow them. I know your foot might be a little bigger than mine. That's true. So you're a physician. Tell us how you got in, because you do concierge medicine. Isn't that what it's called? Direct primary care. Yep, that's right. Yeah. And so you went to work with Dr. Dukes.
with AnMed.
Mhm.
You were with him for how long?
7 years.
7 years. And then you decided, like, what made you make the jump into, I mean, basically, you're an entrepreneur
Yeah.
and you're a doctor.
Mhm.
So you started your own practice. Like, what were the things that led you to do concierge medicine?
So it was really straightforward. Dr. Dukes was my hero, my mentor. I wanted to be like him. And so, he was an old country doctor and he just poured into his patients. And sometimes that takes time. And one of the things that we all have experienced in medicine is it seems like there's less and less and less time to spend with that a doctor has to spend with their patients.
Dr. Dukes loved to spend time with his
He
patients.
loved to spend time. Well, we know Dr. Dukes took a long time with his patients, but you also had to wait because of that. So I grew up in a family that really taught me to value and respect other people's time. So there was this conflict between I didn't want to keep my patients waiting, but I wanted to have enough time. And you really never know as a doctor what you're walking into. Some things are simple, some things are complex. So I was sensitive to that, but I also so the directions in medicine, the pressures in medicine were making that more and more difficult to serve my patients the way I felt called. And then the other thing is that I was learning more and more about what some people call lifestyle medicine and how, what we've learned about nutrition and managing stress and getting a good night's rest and the type of movement and exercise that promotes vigor and vitality. And some of our chronic medical illnesses, uh, they're really a result of our lifestyle. And so we've learned where we can focus and optimize our health. Sometimes that helps people get off medicine or not be on medicine, or at a minimum, it's very complementary. And you just can't write a prescription for that. Like that takes some talking to a patient because I've learned that while we know that avoiding toxins like nicotine and lots of alcohol and other things, getting a good night's rest, managing your sleep, moving, being strong, fit, having stamina, and eating well, that's the universal prescription for health. So every human, that all that applies to. But what I've learned is that it's really an art to make that come to life in any individual person because we've all got things that are pushing us. We have limitations. It's very hard sometimes to exercise. We care about our work. We care about our family. So sometimes you can't sleep at night because you've got a lot on your mind. So how do we make it all work where, we can thrive in spite of the passions and the burdens and the responsibilities that we take on? It's not obvious. So it's a universal prescription, but the art is making it come to life in a particular person. And I kind of think that's what I specialize in.
Mm-hmm.
And so what I really was looking for was a practice where I had more time with patients and my patients I could be on time for them. So it was a small practice. I never liked the language concierge because that just didn't really capture what I was trying to do. But that was the language at the time. So whatever you want to call it, I call it Swann medicine. I wanted to put my own stamp on it. And I'm just, oh my gosh, this is year 14 or so in this community. It's been embraced. So I had 7 years with Dr. Dukes, and I really sought his blessing to do this, which he gave me. And then he became my patient as well. So, it's been incredibly fulfilling. It's also, there's culture that matters in any organization. We know how important culture is, but in healthcare, the impact that your team has, they need to feel it.
Mm-hmm.
And some of our big medicine has really removed that from a nurse's experience or a physician assistant or you name it, a front desk receptionist. Some people, their jobs at medical offices are only to deal with prior authorizations and referrals. And they can feel really disconnected from patient outcomes, and they ought not because they're very important. So it's really important to me to kind of recapture this opportunity to build a culture where my medical team felt like they really had an impact because they are. So that's been one thing that's been fun about creating that. And ultimately that transfers to a patient experience. And most of our patients are really, all of our patients are really happy. And I think they feel like we've created tremendous value in their life. I like to say I'm in the quality of life business because when you have your health, when you have the energy and stamina and the cognitive ability, then you're equipped to pursue whatever your purpose is, whatever you feel called to in life. But anytime your health is slowing you down, some of that is diminished. And so, love doing deep dives, and that includes blood testing and things like that, where we can really get individual insight into any particular patient, and that helps this idea of bringing a plan to life in this particular patient. Does that make sense?
Yeah. Oh, yeah. It's more of a proactive approach.
It's very proactive because it feels good to feel good.
Yeah.
Why not?
I mean, so many of us just wait till we get sick to go to the doctor. And then, we work, we're stressed, we do all these things in our lives. And then all of a sudden, like, things hit us and we're wondering why we're getting sick. Like, it seems like you're trying to take more of a proactive approach with your patients. And so I think that's really cool, because I remember you telling me when you first got started how, I mean, I don't want it to seem derogatory or anything, but like it was like a cattle call, right? Like, I mean, the goal was to see as many patients as you possibly could in a day. And for some people that fits, because that fits their lifestyle. They're not really taking the proactive approach. They're taking more of, I'm sick, I need to go get medicine, I need to see a doctor in order to get the medicine.
But it doesn't work.
Yeah.
It only works if they can get in.
Right.
In a timely manner.
Yeah.
And a lot of people opt out of healthcare because of the inconveniences. And a lot of men particularly don't access healthcare. And then you have a whole other world of people who work jobs, and their jobs really demand their time. There's not a lot of flexibility, and the doctor's office is only open when they're at work.
Right.
So there's a lot of barriers to care that are just kind of neglected in the system, and that's not right.
Right.
So, and that kind of comes back to physician leadership, physician ownership of the patient experience. I wanted control over that. I wanted to powerfully influence that, and I found in my previous setting where we were, I was an employed physician. I just was disempowered, and I wanted to kind of take the reins back, and just doing it the right way. It kind of has an influence in the community, and other doctors see that it's how it's working, and it's resonating with patients. So it's been awesome, and we're up to good stuff. The last thing I'll say about this is that when you transform somebody's health when you help them help themselves, and it's transformative, it doesn't just help that patient. Their family notices, their coworkers notice, people start paying attention. And we have a lot of subtle influences on what I call our garden, the people around us. And you don't even necessarily know that somebody's noticed and is paying attention. Mm-hmm. And then 3 months later, they come up and they say, I want to talk to you.
Right.
And it's pretty awesome. So to see that kind of ripple effect up close and personal, it's just one more little thing that's helped me be convicted about the way we're practicing medicine. Regarding making money, doctors put their soul into what they do, or I certainly feel that way. And I'm really thankful to have a job where I make a good income. And so what I felt stifled in really fulfilling my calling. So I was looking to make a change in practice that would allow me to be freer, and that certainly has happened. But it was not about money, and I was actually willing to take a pay cut to do it. And so, but it turns out that it's just been really well received. So, this kind of goes back to just doing things for the right reasons. Mm-hmm. And when you're doing it for the right reason, if it resonates, it tends to work out. So it has for me, and I'm thrilled, and I can't tell you how appreciative I am of the community for embracing it.
Before we get into the next topic, tell everybody where you're located. You're over by Mojo's Coffee.
Yeah, for people that know Clemson, the old Napa Auto Parts store that's turned into Potbelly Deli, which is a wonderful thing. I'm right behind that. or right beside that, and then Mojo's Coffee Shop is on the other side. So I'm actually in the complex with Mojo's. Nice little small place, um, very intimate, open. I wanted it to not feel like a doctor's office.
Yeah, it's
So
very well appointed. You go in, it's got a real warm feel. And
yeah, when you come in, there's no glass walls. It's just we're just there, and that's kind of the feeling that is important to me.
yeah,
That sets when you walk in, that's the your first taste of our culture. We're not putting barriers between our patients. We're I like to say we're conduits, welcoming them and engaging with them, and it matters.
right. All right, so now that's kind of a perfect segue into the next topic that I wanted to talk to you about because I think it's really exciting. You being entrepreneurial, I'm an entrepreneur, and so I love talking to other entrepreneurs, and it's been real cool seeing you start your new business, Tiger Diagnostics Laboratory. So tell us a little bit about that.
Sure, I'll try. I'll do a little bit of a segue into it, but I never really thought about myself as an entrepreneur, right? I just found myself in my previous practice um, looking for something different, and I started to explore it, and I found an opportunity, and I pursued it. So then I had a new business, and then during COVID, we had a unbelievable problem, and we all remember the uncertainty that was present in the very beginning.
Mm-hmm.
And I remember, frankly, being a little bit intimidated and frightened about what was coming. Um, but I looked at my staff and I said, "Listen, we're either gonna meet this moment or we're gonna be exposed as frauds. If we're physicians, we're this is our time to respond." So we did everything we could to make an impact. And one of the things that we did was we got involved in testing. And at that time, people will remember it took forever to get a test back, and there were all kind of supply chain shortages. But at the same time, lots of businesses were threatened, and the business of Clemson University was threatened. And at that time, Harvard and Yale had already closed their doors. They told their students not to come back, but Clemson wanted to stay open. And we all know that this town wanted a football season, wanted to stay open. So Clemson started building their own tests from scratch in house. They said, "Hey, we've got the scientists, we've got the PCR machines. The standard is not really working. Let's see if we can figure it out." Well, at that time, we were testing in my parking lot, and I'm an independent doctor. I don't work for a hospital system, and so I've got a lot of friends that are in those systems that were disempowered. They didn't have the freedom to respond the way I did. And Clemson was looking for somebody who was doing some testing that could validate the test that they were building. They needed somebody to prove it out. And the hospital systems were locked up with these national labs, and they had contracts, and they were not really able to participate. And there we are in our parking lot in June, just miserable, covered up in I was in a painter's suit because I couldn't get any of the PPE. And we were just doing our best. So we partnered with Clemson. What they built was unbelievable.
Yeah.
And then we were able to turn that around to the community in a magnificent fashion. And it had a huge impact. But as I've reflected on that, that's also kind of entrepreneurial. It was just responding to a moment, and never made a dollar off of that. That was that never even crossed my mind. We were just doing what we could do to help. But we had to collaborate. We had to find how to solve these problems, and then make it come to life. And it just was unbelievable. But as I reflect on that, that's very entrepreneurial. So I've
Mm-hmm.
never thought about it that way, but it is. And so fast forward, I've got a new project that is a little bit of an offshoot of really a blend of the culture and the way I want to practice medicine and what I learned from working with Clemson University. But we've built a diagnostic lab called TIGER Diagnostics, and this is just another place that you can come as a patient and have your blood tested, or your physician can send you with an order and have your blood tested. But the bottom line is, in my practice, a couple things with labs had changed in the past couple years, and the really good experience I was used to really started to deteriorate. And one of the things as a family doctor is your patients will come in sometimes and they're sick, and you've got work to do to figure something out, and you want to do your work and get results in a timely manner. And so some of the changes had started to cause some inconsistencies in turnaround time and really just uncertainty. I didn't know when I was going to get a result back. And so when you lose confidence, you might say, "Oh my gosh, do I need to send this patient to the emergency room for timely testing?" So the lack of timely turnaround had become an issue, and then just quality customer support. Like when you're working with an outside laboratory vendor, uh, there's things that you need, and if you call somebody, you want someone to pick up the phone. You don't want a phone tree. Uh, you want to know that you can get to a solution quickly, and then even the way samples are treated sometimes. I know my staff, they're really good at what they do, and so we draw the blood, and a couple things happen, and then ultimately gets to the lab and it's processed, and we would get some kind of comment like the lab was drawn incorrectly, so we wouldn't get a report. Well, we knew we did it the right way,
Hmm.
and we were just kind of getting uh, a spin, and when mistakes were made, people would not own their mistakes. So it created a quality issue in patient experiences and support. And because of what I learned in the Ready Lab, and because of the fact that I knew that my pain points were being shared, not just in this community, but frankly across the state, um, kind of an opportunity was revealed that we should consider this. And I wasn't really looking to do it because I'm very happy and wanted to do other things with my free time, but the opportunity to do something better that really impacts patients, I just kind of can't stand it. I'm attracted to that. And
Hmm.
so that was 2 years ago. It took us about a year to build the lab. It's a very complex process. Uh, Lots of barriers to getting started, as just from a business perspective, incredibly difficult. But we have a seasoned team, and we have every member of our team has a pretty significant risk tolerance. So we're just not afraid to be determined and stubborn. And we've made incredible progress. So we've been serving patients for a year, and we kind of worked out some of the kinks, and it's going really well.
So I think you told me a while back that what led to that kind of terrible customer service and everything was a lot of the smaller labs that existed got bought out by maybe a bigger lab. Is that what
Yeah, I
happened?
mean, this is not good for our community either. There
Yeah.
was an excellent lab that I had worked with before that did the kind of work that I wanted to do, and you would kind of call them a regional lab because they weren't far away, and they did such a good job that their business grew organically, and they were bigger and bigger and bigger, and so one of the national labs decided to come in and make that single owner an offer he couldn't refuse, so he sold the lab, and then they just closed it. They put about 100 people, upstate jobs, out of work, and the big labs that do the bulk of the work in the state of South Carolina, it all goes out of state. Some of it goes to North Carolina, some of it goes to Georgia, and then beyond. And so all this stuff is these jobs are exported, and South Carolina people like to take care of their own.
Hmm.
And so one of the visions of our new lab, Tiger Diagnostics, is to take care of our own. And there's kind of a three taglines that really capture who we are. We're a patient first lab, and that means we always put patients first. When you're trying to squeeze the juice out of the lemon to make another dollar, uh, you stop putting patients first.
Hmm.
And so, as a physician, a convicted physician, um, I said, we're only going to build this company if we can do it the right way. And the first thing is that we put patients first.
Right.
And then we are physician led, and I can't tell you how hard
That's
that
really
is
cool. Yeah.
in modern medicine to have a physician lead a startup. Um, and physicians are just so in tune with what patient needs are, what facilitates quality care, and what other physicians really care about. And a big issue in healthcare, the things that frustrate patients are the fact that the incentives that drive decisions have been uncoupled from what patients care about the most and doctors care about the most. And there's just other incentives that have become important and distracting. And so, in my personal medical practice, we fixed that. We reconnected doctors and patients. And as we have built this new company, I have put that culture into our company, and putting patients first and being physician led. It really matters. And then the last little tenet is that we care about the community. We're community minded. And so whatever's going on, we want to pivot. And so the measles is an example of that. So, in upstate South Carolina, we're making national news for a measles outbreak. And I've had patients asking me all the time, like, what do I do? Do I need a booster shot? And so we've been paying attention to what the CDC says. And one thing that people can do is if they don't know their vaccination status with confidence, they can go get another shot of what's called an MMR shot. They can go to the pharmacy and get that. It's either free or inexpensive. But not everybody's thrilled about vaccines either. Some people don't want to get a vaccine. So you can do a blood test to get your antibodies checked for measles.
Oh, wow.
Yeah. So some people would want to prefer that. Well, Tiger, we can do that test. And so because of this moment, we've made that test available very inexpensively. Our prices, we're trying to like democratize access.
Mm-hmm.
Why make it, other companies will look at this as an opportunity to take advantage of. So they'll put out some high prices there and just see who bites. But for me, that's not the motive. I want to make it accessible. If it's important to somebody, so we're work to get those prices down to get access.
Yeah. So you had told me earlier you had direct to consumer testing, and you've got on your website, TIGER Diagnostics Lab.com. You can go to the direct to consumer testing portion of the site, and it gives you a list of all the different types of tests that y'all will do, and people can just show up, or do they need to make an appointment? Or
so really people can just show up. So let's talk about this for a second. Direct to consumer offerings is kind of this a really important and expanding trend in healthcare. And there's a lot of reasons why, but many people have high deductible health plans and they might never meet their deductible. And certain tests that they might be very interested in, if they can't get a diagnosis code from their doctor to attach, the insurance won't pay for it.
Mm-hmm.
And so there's a lot of gaps that leave patients who might be interested in learning something, but going to their doctor to get it done or having the insurance pay, there's these barriers. So in many situations, patients can come have testing done without a physician's order and learn really important information. So because of the pricing models and access models, there's a thirst amongst patients to be able to just access testing. I mean, the internet, ChatGPT, people can ask questions and get really quality information. I have patients come to me all the time, say, hey, I want to have this test done and this test done and this test done. And they're well informed. And my patients can access me pretty easily. But if you get curious and you can't access your physician to get an order, we've made our prices significantly low.
I mean,
and you can just come without a doctor's order, and you can schedule an appointment, but you can also just walk in.
Mm-hmm. Yeah, I mean, looking at this list, got Wellness Basics, $43, Signature Wellness, $129, Signature Cardiac, $88, High Risk Vascular Discovery, $200, Men's Health, $96, Women's Hormones Plus. I mean, there's all kinds of things that you can get tested here.
Mental health panels.
Mental health.
Yeah.
And everything seems very reasonable.
Yeah. This is also what I call patient. This is the patient first part, right? Patient first pricing. There's two ways you can handle price points in business, right? You can try to find the highest price point that a few people will pay, or you can find a price point that's low enough that will drive volume and patients will come because you've made it accessible. So that's the way we want to do business. We're not trying to take advantage of a situation. We're trying to open the doors so that people can come in and get powerful information that really helps guide their daily choices in an impactful way.
Yeah, and it blends well with taking the proactive approach with your health. Like if
Absolutely.
you can easily go get some of these tests done, you're more likely to
Yeah.
do it. So yeah, that's really cool.
I'd love to tell you about two kind of ideas, just to kind of give you a taste of what that means.
Yeah,
That sound good?
yeah.
So these are things that I do in my physicals for my patients, and they're things that I really value. And let me just say that there are tests out there that you can. There's some products out there that I've seen it on social media that let you go do 1,000 tests. And when I've reviewed those, maybe a third of them at best are clinically useful. But the third that it is really good. And so I wanted, because we wanted to make this accessible, I said, let's not do the fluff. Let's do the stuff that matters. But
Mm-hmm.
some of the stuff that matters is not in a standard physical. So there's, we got scientists exploring new ideas and making great progress. And the newest, most impactful thing does not always make it. It doesn't, not always. It rarely makes it into the standard uh, status quo physical. It takes
Mm-hmm.
years for that to show up. So everybody knows about cholesterol and LDL cholesterol. We call that the bad cholesterol. And high levels of LDL have been observed over time to correlate with risk for stroke and heart attack. So we've learned that it matters, and we've learned some of the things that influence that. Well, we've also learned about something called apolipoprotein B, or we call it ApoB. And why this matters is this serves as the delivery truck for the bad cholesterol. So the bad cholesterol is made in your liver, but for it to get from your liver through your system and then invade the wall of an artery, it cannot do it by itself. It has to be delivered. And so this ApoB or apolipoprotein B is the delivery vehicle that it hooks up with. So if you don't have the delivery trucks, you can't deliver the payload.
Right.
So some cardiologists, and really just in the general consensus, is coming to conclude that ApoB is a better risk indicator than LDL. And it's not sensitive, not very sensitive to fasting. So people can have it drawn at any time of the day. And for most people, the LDL predicts the ApoB by a factor of one. So if your LDL is 140, your ApoB is very likely to be 140. But sometimes the ApoB is a lot less than you would expect. So a patient can go to the doctor, and the doctor can tell them, you've got high cholesterol, you need this medicine. And if they don't look at their ApoB, they are under investigating.
Mm.
And so, because they might find that that person's ApoB is much lower, and then that would change your risk assessment. So it's insightful. It's not an expensive test. It doesn't fall into the standard physical. It's work for your insurance to pay for it, but it's not expensive. So
Mm.
why don't we just make it available? So
Right.
looking at LDL with ApoB, and then the big one that is incredibly important is something called lipoprotein little a, or LP little a. And whenever you hear it referred to, they will always use that little a. So if you think about these delivery trucks loaded with this bad LDL cholesterol, that's how it works in most people. But about 1/5 of people make LP little a. And a significant percentage of those people make a ton of it. And like 3 to 5 times normal. It's really significant. And that functions like a turbo booster that sits on the back of these delivery trucks. And they just slam into arterial walls, and their ability to cause atherosclerosis, to promote inflammation that makes that developing plaque vulnerable to rip and tear and then clot. It's significant. And 1 in 5 people make this. And it's an inexpensive test, and nobody knows. This is a huge deal. Everybody, frankly, everybody in America ought to know where they stand. And so you cannot get your insurance to pay for this, and it's inexpensive. So I'm like, we have to make this available, and we're not cost inflating it. We're giving it for a price point that opens the doors of
Mm-hmm.
opportunity. Anybody can come get it. So part of the resistance speaks to a problem in medicine. So I've talked to friends, other, my cardiology friends. I'm like, what's going on here? And so, because there's not right now, there's not a drug that treats LP-little-a, and we've not learned of any lifestyle intervention that influences it. It's kind of like it's genetic, and if you're one of these people that produces it, you're going to produce it, and we can't do anything about it. And so the thought has been, well, why should we test? We don't have a treatment for it. And I'm like, that's crazy.
Yeah, it was.
We do have a treatment of of things that lower cardiovascular risk. Get lean, eat well, exercise, manage your stress, don't smoke, stop over consuming sugar. There's just so many things that we can influence. And so while I might not be able to influence that individual risk factor, that information empowers me to be motivated to really act.
Right.
And then the opposite might be true also. I might find that I don't make LP little a, so I go have a cheeseburger. I'm not encouraging that, but I can tell you the people where we find it, it really matters. And so this LP little a is an independent risk factor for stroke and heart attack, as bad, if not worse, than smoking. And everybody gets the fact that smoking matters. So if my genetics are doing something to me akin to smoking, I ought to know.
You ought to know.
Because I would have quit smoking a long time ago from all that we've learned. In fact, America um, has essentially quit smoking. When you look at who smoked, who used nicotine regularly 50 years ago, it was most people. And now it's not the norm. So we ought to know this information. And I have patients are walking around and they have no idea, dramatically increases their risk. So that's an example of something that is not on your standard physical, that we've made very inexpensive, that people in our community can come without a doctor's order, and in very short order we can give them that result, and then they can take that to their doctor.
So is that a separate test, or is that like?
So that's in the like the cardiovascular insight.
Okay.
I think, is that what it's called?
Yeah.
What does that say?
Signature cardiac.
Signature cardiac.
Yeah.
Okay, so it's in there.
Yeah.
But that and there's more to it. So one of the other things I wanted to mention that's very insightful about a couple extra tests that do not show up on the regular physical are what I call metabolic efficiency. And so one way to think about health is that your body has a gazillion tasks that it's attending to all the time. It's why we have a body temperature. We're generating heat from the work that we're doing. So your body's attending to tasks. And if your body can get today's work done efficiently, that's what it means to be healthy. It's that simple. But if your body is burdened or has to hustle to get the work done, it might still keep up. By the end of the day, it might get the job done. But if it's hustling, it's inefficient. And if you multiply inefficiency by years, those systems break down. Mm-hmm. So we know what disease looks like. But what we're really looking for are these inefficiencies that haven't shown up as disease, but the writing is all over the wall. And so metabolic efficiency this is America's problem. We know that a lot of us carry more weight than we want, and some people really struggle with obesity. And we know how transformative it can be when patients can lean up and eat differently. So it matters. Every chronic disease that we deal with in America is influenced by that, including cancer. So this metabolic inefficiency is America's problem, and a lot of us and our friends and family deal with it. So what shows up on a standard physical that sometimes will reveal this is you might have an elevated blood sugar. Once that's happening, it's already slipping away. You will see somebody's triglycerides, which is part of a standard cholesterol panel that does show up higher. Now, not everybody has high triglycerides, but they will have a higher level than that it ought to be that can show up. But there's the real insight is when we check what's called a hemoglobin A1C, which gives us a 3-month perspective of your blood sugar, and a fasting insulin. That tells us how much insulin is being used right now to manage your blood sugar. And if it's efficient, it's a very low amount. So the lowest amount are in my triathletes. They're just lean, mean, fighting machines. All that work they've done has created an incredibly efficient system. But sometimes we find that the amount of insulin being utilized to manage is very high. Their blood sugar is normal. It means the dam hasn't broken yet. But we see those high levels of insulin, and it's the warning sign. This system will break down. you could go to the doctor and they say your blood sugar's good. What does the patient think? They think they're good.
Think you're good,
This is a cheap test, and just by doing that one test, you can see. And then the other thing that speaks to metabolic efficiency is something called small dense LDL. So LDL is the bad cholesterol, but we've learned that like the Newtons and like the Swanns, uh, the bad cholesterol is really a family of subtypes. And so, as we all know, the Swanns in Clemson have a bad reputation. But if you look at the boys and you look at Susie and you look at the dogs, they're all good. Ted gives the family the bad name. So we think that the small dense version of the LDL cholesterol is the real problem. So everybody makes it, babies make it. It's supposed to be there, but it's not supposed to be overproduced. So we can check the small dense LDL level. It should never be more than a third of the total LDL. And when it is, it means that this person is doing something that is driving a problem. And we got to figure out what lifestyle choice it is to kind of, get this thing back in the right direction. And I mean, this is just not complicated, and it will not show up on a standard physical, and it ought to. So we're making it accessible. It's really important to me to not try to scare people into testing. I only want to have things that are clinically useful, powerful information that can give a patient insight that can then guide their decisions. And that takes us all the way back to managing your stress, getting a good night's sleep, eating thoughtfully, being active, and avoiding toxins. Because, life is about living, life is about celebrating. And so at the end of the day, we all kind of want to have our cake and eat it too. And so, speaking of cake, like birthday cake, there's nothing valuable from a nutritional standpoint about that, but it's one of the best things in the world because if we're eating birthday cake, it means we're celebrating life with the people that we love. So there's a place for it, and if we want to have friends over to entertain and celebrate friendship, we like to cook things that everybody likes, and our culture really wraps food up in how we engage with our friends and family and tailgates and things like that. So we want to find a way to kind of do it all. And, if you have a day where you have a good night's sleep and you've managed your stress and you got up and you did some exercise and you had a nice lunch and breakfast, and then all of a sudden dinner time comes and you want to have an indulgence, you feel free to do that.
Right.
And so this is the type of thing that lets us not just pursue health, but pursue health with some flexibility and grace that lets us enjoy life and promote a real quality of life. And so, that's what makes me tick. And what I call democratizing this information. So it's not just happening in my practice, but we're making it accessible to anybody. That's why we're doing it. And that's just one part, but that's the whole direct to consumer thing. And so we're going to be pushing out that message. I'm sorry, I can really get talking.
No, hey, I forgot we were on a podcast. I'm sitting here listening to you talk. It's pretty incredible. You make me want to go get tested for some of these things.
Yeah.
I have a fatty liver, and I never have been able to figure out what's causing it. Like, I've been able to adjust my cholesterol at different times based on diet and things, but it's still kind of the fatty liver's still there.
Yeah, well, that matters.
Yeah,
that matters, and you want to know, you want to be as informed as possible so that you can navigate your health because it's not intuitive. There's things that you want to know that you'll make decisions, intelligent decisions.
I'd love to be able to find out if it's okay for me to eat white chocolate Reese's peanut butter cups.
I can just tell you that it is. It's not about can you, it's about how much and how often.
Yeah.
And in America, it's Thanksgiving every day, right? And so we have these choices that all the time we can make these choices. And unfortunately, the easy choice, and unfortunately for our community at large, particularly people who might have be socioeconomically disadvantaged, a lot of times the cheapest choices are the easiest choices, and they're some of the worst foods, most nutritionally devoid, lots of sugar, lots of junk food fats that are very inflammatory. Our food system is upside down.
Very
And so, and all of these things are just not really focused on by big medicine. We have chandeliers in these cathedrals of big medicine, but some of this basic stuff, which should be on the signs that you walk in, um, they're not there. And so, this is my check as a physician, and the reason why I think physicians should reclaim leadership in healthcare is because this is not rocket science. And this is a product of the uncoupling of incentives of what matters to doctors and what matters to patients and what matters to administrators. And I have a little bit of grace for them because it's complicated. At the end of the day, we can't serve patients if we can't keep the lights on. And some of the way administrators function is just a response to the way the system is built. And if you don't see, we talked about seeing a lot of patients before. That's the way you keep the lights on in the standard model is you churn and burn, see more patients, bill more, and that's what pays the staff, and that's what pays the rent. Um, but we don't need we shouldn't accept that. We should we should we should improve it. And so practices like mine are kind of a check on the system, and just seeing that patients value that, it just tells me that we're doing something right. And so I try to get in the CEO's ear, um, just to be an influence. And like I said, I do have a lot of respect for the challenge, but I'm not content with where they are. So I always want to invite a conversation, I truly try to be respectful. I'm passionate about what I think, and I share it. But this goes with our legislators too. There's a lot of people are involved in the current state of our medical system, um, and I just want to be a part of that.
It's probably a conversation for another podcast,
That's
but
probably
like it is. I have always been a little bit fascinated by how hospital systems work,
Mhm.
and I would that is something that maybe we could come back and talk about
Sure.
at some point. We've got a lot of satellite hospitals within different networks that are popping up in a lot of different places,
Yes.
which is cool
Yes.
in a lot of ways. I'd love to hear your take on that. But before we end the podcast, I'm curious. How'd you? I mean, it seems obvious to me, but like, how'd you come up with the name Tiger Diagnostics Laboratory?
Well, we are Clemson people, and we're susceptible to
Yeah.
influence. Um, but I love the idea of a tiger for for our lab because we're a small startup in frankly a mean world of 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 incentives that are not exactly what patients and
Mhm.
doctors care about. And I can promise you, because we've already seen it, as we are successful as a lab, some of these really big players aren't going to be happy about it.
Right.
So the tiger to me is, look, we're going to do our thing, we're going to do it well, and we're not going to mess with you, but you don't want to mess with us.
Right.
So we're minding our own business, but we also are. We got a lot of things going for us, and we've had a lot of success, a lot of early success. So we're very encouraged, and like I said, the vision is to serve the whole state of South Carolina. I was at a physicians conference in Charleston this past weekend, talking to independent doctors, and our mission just resonated to the core. And when you get that kind of feedback, you're like, okay, it puts the wind in your sails,
Hmm.
and it just gives you the energy you need to kind of keep moving forward because it's not easy, and we've learned a lot, but we're on our way.
That's awesome. Well, I'm proud of you.
Thank you.
I think it's awesome what you're doing, and
Thank you.
a lot of people, contrary to what I might think, a lot of people think highly of you
Well,
in
yeah,
the community
it's a problem.
and the things that you do. And
Yeah.
I mean, like during COVID, you didn't have to do it, but you were putting out data, putting out information, trying to put people's minds at ease about things, and coaching people on how they should live their lives during that
Yes.
time. And then I've seen you put stuff out about the measles and things like that. And I mean, you certainly don't have to do that. And it's admirable for what you're doing in the community. And
Well, I appreciate it.
Glad to call you my friend, Ted.
Amen. Amen.
Yeah.
We're always dealing with imperfect information.
Yeah.
You know, so we're only ever capable of doing the best that we can with what we have. But that's where, you know, a physician comes in to help give us guidance. And that's where a relationship comes in, because that's not just one time, right? That's an ongoing conversation that really never ends. So I love what I do. All my thanks goes back to Dr. Dukes for inspiring me, and this community has been awesome. And I'm just a real happy doctor. So thank you for your friendship. Thanks
Yes.
for this. Thanks for this opportunity. It's pretty fun.
Glad to do it. And you know, I know you and the boys came over and got some of the firewood over the.
Yeah.
I made a goal this year to do more agri fitness.
Okay.
So if you ever
I like
want to,
that.
if you ever want to bring the boys over to,
Yeah.
I've got plenty of trees that I've still got to cut up from Helene. So if you want to bring them over, and I mean, we could spend.
We'll do. I'm the worst chainsaw operator.
I'm good. At
I like a good chainsaw, and then once that chain comes off, it's the hardest thing for me to put back on. So
well, you can
teach
me. Splitter. You can work the splitter.
Yeah. No, I need to learn. So we'll do it all.
Yeah. Well, hey, I appreciate you coming on. Let's definitely do it again.
Okay.
Definitely do it again. And this has been another Experience Matters with Eric Newton. Thank you.